Disclaimer: this podcast is for educational purposes only and should not be taken as medical advice. Always consult a qualified healthcare professional before starting or changing any treatment, including the use of peptides or supplements. Today we are going to explore alpha-melanocyte stimulating hormone, also known as alpha-MSH. This peptide belongs to the melanocortin family and plays important roles in pigmentation, energy balance, immune function, and even sexual behavior. It is naturally produced in the pituitary gland and circulates to interact with specific receptors in the body. One of the most well-known functions of alpha-MSH is its role in stimulating melanocytes, the cells responsible for producing melanin. Melanin is the pigment that gives our skin, hair, and eyes their color. When alpha-MSH binds to melanocortin 1 receptors on melanocytes, melanin production increases. This is part of why sun exposure, which activates the release of alpha-MSH, results in tanning of the skin. Researchers have studied this pathway to create peptide derivatives like melanotin that mimic the pigment effects. But pigmentation is only one part of the story. Alpha-MSH has broader systemic effects because it interacts with several melanocortin receptors found throughout the body. For example, in the brain, alpha-MSH helps regulate appetite and energy balance. When alpha-MSH levels are high, the body tends to suppress hunger signals and increase energy expenditure. This connection has made the peptide and its analogs of interest in the study of obesity and metabolic disorders. Beyond energy and pigmentation, alpha-MSH also has strong anti-inflammatory effects. It can dampen the production of pro-inflammatory cytokines and promote the release of anti-inflammatory signals. In animal and early human studies, this property has shown promise for conditions ranging from autoimmune diseases to tissue injury recovery. By calming excessive inflammation, alpha-MSH could help maintain balance in the immune system. There is also evidence that alpha-MSH influences sexual behavior and arousal. Activation of melanocortin receptors has been linked to increased libido in both men and women. This effect has inspired pharmaceutical research into melanocortin receptor agonists as possible treatments for sexual dysfunction. While alpha-MSH itself is not widely used in clinical practice, its analogs and derivatives are being investigated for this purpose. One of the fascinating aspects of alpha-MSH is how it ties together pigmentation, metabolism, immunity, and even behavior through one family of receptors. This highlights how interconnected different systems in the body truly are. A single peptide can influence skin color, appetite, mood, inflammation, and sexual response depending on where its receptors are expressed and how they are activated. In terms of therapeutic potential, alpha-MSH has been studied for skin disorders like vitiligo, where melanin-producing cells are damaged or destroyed. By boosting melanin synthesis, researchers hope to restore some natural pigmentation. In inflammatory diseases such as arthritis or inflammatory bowel disease, the anti-inflammatory properties of alpha-MSH may one day help regulate immune responses. Safety and side effects are important to consider as well. While alpha-MSH itself is a natural hormone, the use of synthetic analogs has raised questions about safety, dosing, and long-term outcomes. Some reported side effects include nausea, flushing, and changes in skin pigmentation. Because the peptide system is complex and affects many body functions, more research is needed to fully understand its benefits and risks in therapeutic use. Overall, Alpha-MSH is a remarkable peptide that illustrates the wide-reaching influence of signaling molecules in the body. From helping us tan in the sun, to regulating appetite, to calming inflammation, its roles are diverse and interconnected. As research continues, we may see new clinical applications of alpha-MSH analogs in dermatology, endocrinology, and immunology. Disclaimer: this podcast is for educational purposes only and is not intended as medical advice. Always consult with a qualified healthcare provider before starting or changing any therapy. Thanks for listening, keep learning, and stay curious.